Welcome, everybody. This is the Rotary Club of Silicon Valley, and every week we bring you the stories of people who are making the world around them better. We love this in so many ways. Rotary International is very much an organization built to improving communities and helping those in need. And our particular version of Rotary, the Rotary Club of Silicon Valley's model for Rotary, is an online and asynchronous one. As it happens, our speaker today is also from an online and asynchronous club, the Rotary E-Club of WASH. You are going to learn about WASH in the presentation and in the Q&A that follow. We are excited to have Heidi telling us about the work that her organization is doing in Malawi. To read the full bio, pause this recording, whether it is a video recording on YouTube or an audio recording on your favorite podcast app, and you can then read the entire bio. But suffice it to say, Heidi's a really cool Rotarian doing some really cool work. And Heidi, we are excited to have you. I hand the mic over to you.
Thank you so much, Rushton. It's lovely to be with all of you fellow Rotarians. My name is Heidi Rickels, and I am the director of Freshwater Project International. We're focused on solar wash systems in Malawi, Africa. So today I'm going to be talking to you about an approach that we take called nurturing resilience, really looking at a systems approach to wash in Malawi, and in particular, our wash in healthcare facility program. We've been focusing on wash in healthcare facilities for the last decade, really moving beyond just a water point to really looking at the entire system of the health center. In Malawi, where we work, many of the health centers are rural and off-grid, and many have existing uh, water systems in place or sanitation systems in place, but there's some sort of a failure mechanism over the years, whether it's corroded pipes, whether it's broken pumps, broken burned out pumps, leaking tanks, um, a lot of different issues with these systems, and many of the health centers are no longer viable with their water systems, and so they are utilizing community water points and carrying the water into the facility. And so we go in with our partners. We've been focused on an impact program in one district, partnering with Engineers Without Borders USA, and also Xylem Corporation, a multinational water wastewater company. They have worked side by side with us and mentored our in-country technical team to upgrade wash systems and provide reliable, clean running water and sanitation systems at every health center in a single district in Malawi. I'm going to be zeroing in on a particular project that we did in partnership with the Rotary Club of Blantyre and with the international club, my club, the Rotary E-Club of Wash. This was a global grant that we compiled over several years, starting in 2020, and will really highlight the entire impact program that we accomplished in Zomba district. So we started with this very rural health center. It's difficult to get to and to access. It serves about 25,000 people across 45 villages with only 3 buildings. There's 48 staff and 8 staff houses, but it's in a very limited space, and there's only 7 inpatient beds. But it still cares for 370 patients daily, addressing critical health needs in a very underserved area. There were some really difficult challenges that were identified in our technical assessment, some critical gaps in wash infrastructure. There was an inadequate 5,000-liter tank that was leaking literally into the courtyard where the patients waited. There was a corroded water distribution system and many broken fixtures, key rooms that entirely lacked a water supply, and low pressure and erratic water supply to the staff houses. For waste disposal and even gray water, there was no septic tank, insufficient latrines, hand washing stations were inadequate, poor gray water management, and wastewater drainage was broken. So it was a really difficult situation that we stepped into. Our recommendations after our in-depth technical assessment was an urgent upgrade and actually brand new construction of a new tank tower and 10,000-liter tank, replacing the entire water distribution system from corroded pipes to a new HDPE distribution system, establishing new piping to rooms in need of access, fixing plumbing issues, sinks, taps, inlet, outlet valves, installing a new standpipe outside of the pit latrine area for hand washing, and building a brand new laundry station. For waste disposal, we wanted to maintain and fix the drainage system, divert gray water to new soakaway pits, and we installed a brand new septic system, including 2 new flush toilets. We also saw the need to construct an entirely new maternal waiting shelter that we're calling a maternal wash facility because of the access that it provides for the patients that are waiting, often for childbirth. It's sometimes called a guardian shelter, maternal waiting shelter, where women are able to come from long distances and wait prior to their due date as they wait to go into labor. So we constructed a brand new building, including a kitchen with a sink, a washing basin, and then a room that also had a sink that provided shelter and security for the entire facility. So you can see some of the photos from implementation. We always utilize local subcontractors. Freshwater performs all of the oversight and general contracting supervision. You can see everything from the brand new septic tank being constructed to the hand washing basin, even the cook stoves that we installed in the maternal wash facility. The construction of the new tank tower was a major component. And then all along, we included the Blantyre Rotarians and our Rotary E-Club of Wash. You can see Philip Woolstenholme, who is in the center, who came from the Rotary E-Club of Wash. He lives in the US. And he partnered with Patricia from the Rotary Club of Blantyre, and then Manuel Nangazi, who is our freshwater country manager, who is now also a Rotarian in the E-Club of Wash. So you can see this was kind of a midway inspection of the construction, just to provide an additional level of local involvement and oversight from the in-country Rotary Club. And then after the project was completed, we did a wonderful handover ceremony. Many of the Blantyre Rotarians came down. We did tours. We included the local health authorities and community and showcased the system. It was a wonderful ceremony where we really are handing over ownership of the system back to the health center and to the community. The sustainability component was built in from the start. We include the district maintenance officers as well as the facility in charge and maintenance staff in the technical design and of the entire system. So we co-developed with the district health office a record-keeping system that includes all of the schematics for the system so that they're able to provide oversight and preventative care and maintenance and troubleshoot any issues that arise with the system in the future. We also work together with the district health office to conduct environmental hygiene trainings of infection prevention and control for all staff members. And then we included the testing and improvement of a technical manual that is provided to all of the stakeholders in this project. The project impact will continue to monitor over the next 5 years. We utilize a monitoring and evaluation platform called MWater. It is an easy to use platform where various surveys and indicators can be tracked over a number of years. And we utilize that in conjunction with the district health office. So the impacts are great. Improved hygiene standards for both the healthcare workers and patients through the availability of clean water and sanitation systems, enhanced compliance with the existing IPC protocols, enhanced operational efficiency, reliable water supply, reduced interruptions in service delivery, particularly in the maternity ward, boosted staff morale, and improved health outcomes. Zicomo, thank you so much for listening, and I will be so happy to take any questions that come up.
Excellent. A lot of love popping in from the group, and happy to jump into the questions. I'll first introduce the group that we have got on the call. Those of you who would like to wave at the camera, just make sure your camera is not off, but I'll mention you regardless. So from our club, we have got Victoria in Hungary, Cecilia in Italy, Martha here in the Bay Area of San Francisco Bay Area, as I am as well. Good friend Tom in Oregon. Good to see you. Hey, and Yvonne as well. Excellent. And then also from Freshwater International, Priyanka. All right, good to have you. Heidi,
Hello. Hello,
excellent.
everyone.
Hi,
Hi.
hi, hi. So, Heidi, I am excited for us to jump in. There are so many cool pieces of this project. It is so very much in the realm of what Rotary is about, is to do projects well. And that comes from a lot of history of projects not being done particularly well, over the decades. Can you start by contrasting some of the earlier practices of WASH programs that there were kind of certain mistakes they might have been making, or did something that kind of helps people understand this is how we've gone from there to here with the kind of work that you are doing?
Certainly. I think early on in my involvement in the area of focus of WASH, I learned the importance of including the communities and really focusing on a community-driven approach. When you're dealing with community water access, so say a hand pump in a village, um, that is a kind of low-tech approach that makes it really easy to engage with a water point committee that is included from the get-go. So learning that was a really important best practice, that you want a committee or a group from that community to really buy in and be involved throughout. And that includes learning about the system, growing their technical capacity in learning how to do preventative care and maintenance and small repairs. Now, take that from your lowest tech approach and apply that when now you're dealing with a more high-tech solar piped water system. And that's a big leap, but the practice is still important that you want to include all of the stakeholders, including the community. And that involves a facility health management committee if it's not already existing, um, making sure that that is included and integrated, and that they are included in what we call institutional capacity building, gathering all of the stakeholders. The district health office maintenance staff is always included, but also the community health maintenance committee, and then the in charge and the staff in the facility. So we're all working together throughout the project. And so when the project is complete and we hand it over, it truly is felt to be a community asset, not something that an outside group has come in and done. And there is more ownership and pride in that approach. So,
I think that frame of reference is one that can address sustainability in so many projects. That need for buy-in, that need for proper decision making with the people on the ground, and so kudos for making that happen. I do want to dive into some of the high-tech pieces of this. I would be remiss in doing so, given the name of the club. But before we do, some great basic questions that came in through the chat. Cecilia asked if potability is a feature in these projects. So for those of you watching or listening to the recording, potable water is water you can drink. And so to what extent does that work into the details of the project you've described to us?
yes, we certainly do water quality testing. Many times with our health center projects, we are mechanizing an existing borehole or utilizing an existing borehole. In Malawi, those are all deep freshwater wells. We do a water quality test, and all of the water we provide is potable. It has to meet a certain level of standard. Um, there are some facilities that require additional filtration, and so we always look at that as well.
Good, 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 good. And in mentioning the community there in Malawi, that gets us to Victoria's question about how Freshwater International came to work with communities in Malawi. Why was Malawi selected?
Well, the story I tell is it was really through friendship. It was a friendship. I had worked for a another NGO that was focused on healthcare, and was asked by a colleague if I would mentor a wash professional from Malawi who was being brought into to the U.S. for a 4 month fellowship and wanted to learn more. My background is marketing and storytelling, and this gentleman wanted to build his skill set in that area. And so we were partnered together for 4 months in Denver, Colorado, where I lived at the time. And through that exchange, he really mentored me in my knowledge of developing country healthcare, in particular Malawi, and how water, sanitation, and hygiene is really the other side of the coin of health in developing countries, and many of the patients who are in these rural health facilities are there from preventable waterborne diseases, and that also many of the health centers did not even have access to clean water. And so, as a parent, as sometimes patient, just imagining that in your head was so moving to me that I really felt compelled to make an impact in that area. And so it was through this friendship with Charles Banda that started my involvement, and I've continued for 20 years in that direction.
That speaks to another feature of Rotary is that opportunity to connect people from all over the world and to have the kind of conversations that allow understanding where service can be really powerful, well done, effective, right? I think when we think of effective, we think of the kinds of measures, and there are simplistic measures that are important but incomplete. And one of those is one that came up in the chat. Like when we think of the project, you mentioned that the region has about 25,000 people. Does the project itself serve all of those people, or a subset of those people, or how do you think of metrics in terms of people helped?
Yeah, I would say the catchment area is 25,000 for that one particular project. For the larger impact program, and I would have to look back at the numbers, it's an entire district. So potentially it's those patients that are accessing it either for medical care or for delivering for childbirth for delivering their babies. And I think that has ripple effects. Certainly, you're talking about the health of a community because we're primarily focused on Zomba District, and we're not only doing health centers. We also have a very robust Washington Schools program and community program where we're implementing these solar piped water systems that go to multiple locations. So, for example, in one village where we were trying to do just drill a borehole, but we came up with dry wells, and we decided to get really creative, and we capped an existing borehole. We mechanized it. We sent it up to three 10,000 liter tanks, had a massive solar wash system, and that is now serving the school, and then water kiosks in three communities. And so rather than just thinking of one location, one water point, we're thinking of multiple locations and expanding that systems approach. So when you can focus in on one country, when you can focus in on a catchment, and you're looking at different aspects of water access, then you've got a more holistic approach, and you really see those ripple effects in terms of health and impact.
Excellent. Let's do one more question before we wind things down. And that has to do with the M-Water system that you mentioned. So clearly there is a power in being able to point to ongoing metrics in terms of the effectiveness of given projects and building the support network you need with partners in order to expand on those projects. Can you talk a little bit more about that system? So, you said, okay, there are certain indicators that are able to be tracked. And in thinking about those indicators, what has that done for you? I mean, like, are there ways that you have pivoted with regard to how the project works as a function of what those give you? And it may be that these systems are so new that it's kind of hard to answer that question. Um,
Yes,
but
I
it
would
seems
say
but it seems
not yet.
promising.
I
Okay.
would say not yet. We are tracking, it is fairly new. Primarily, we're tracking functionality and through M-Water, but then also through quarterly inspections. We have an ongoing maintenance program going with Xylem. I saw that there was a question about uh, the financial aspect of sustainability, and that's an important question. In addition to building the technical capacity of the DHO in Zomba on that impact program, we also assist them with their line item for maintenance. And so we're working hand in hand, but providing ongoing support and oversight and assistance with maintenance. And so the hope is after a period of time, we would be able to fully hand over the ownership of that to the DHO. Um, but again, that only works because we've worked with them throughout. And if a major repair was needed, say a pump burned out, or I can give the example too of at the system that I described that was went to a school and three communities. Lightning struck the school and caused an issue where the pump wasn't working. And so we were able, with the technical assistance uh, of Xylem, to troubleshoot that remotely and find a way to get the water back up and running at a very low cost. So where that might not be the situation if we weren't providing that ongoing support.
Yeah, I think a follow-up to that, which I'd like to include in our recording, is the one about bureaucratic hurdles in the chat from Tom. It sounds like you have done a lot of really solid partnering with the people on the ground in Zomba, and that includes the bureaucratic elements of all of the different element pieces of the project in order to make it successful, and the outlook going forward. I mean, I hope that I'm characterizing all that not just hopefully, but accurately. Is there something about the nature of the partnership with local governments that has actually been really helpful as opposed to
Well, I would say
slowing it down?
with Zomba in particular, with the DHO, we chose Zomba as our catchment because we saw potential in that partnership. And so, having worked together now almost a decade, um, we feel really strongly about that partnership. We do have other areas that we work in and other partners. In particular, one of our mission partners is CCAP, the Central Church of Africa Presbytery. In the central region, they have engaged us as service providers to come in and upgrade one facility, but it's a different kind of partner. So it's not government run. It's really church run and driven. They have 10 health centers in their catchment. So we're trying to take some of the learnings from working with the district health office in Zomba and implement that in a different context. But it remains the same that you have to have those strong partners on the ground, and those are the managers of the health system, as well as the communities.
Excellent, excellent, excellent. I think that's probably a good place for us to wind down the recording. In a minute, Heidi, I'll hand it back to you for the final word. To all of the people who have taken time to watch this recording or listen to this podcast, know that there are links available to you on the pages where you found them that will allow you to learn more about Freshwater International and the good work that they are doing. You can also find more about us, the Rotary E-Club of Silicon Valley, which is most easily accessed by going in your browser to rotary.cool. Thank you. And so we are always excited to share these stories. We hope that you will share the stories with others. That cousin that you haven't talked to in a while, we just saw this amazing program. Share it. Absolutely share it. We think that the world gets to be a better place, not just because people do great things, but because people help others understand that people are doing great things. And that is something that we are honored to be able to do, is to share stories like the one that Heidi has given us today. Heidi, we always hand it back to our speakers for the final word. What would you like people to have clearly in mind as they finish listening to this podcast or watching this recording?
I think I will end with an invitation, and that is we would love to have anyone from this group or listening to this recording to attend the Rotary E-Club of Wash. You can look us up online. We are asynchronous, as is your club. And so we have various times and offerings. We also record our calls and put those on Vimeo. So look up the Rotary E-Club of Wash. We have many speakers that are focused on various aspects of WASH from all over the world. And so it's a wonderful network to be a part of, and I think would resonate with many of you. There's also upcoming on World Water Day, March 22nd, we're going to be showing doing a film screening. And so you can find us online and register for that as well. Make sure you have the link.
Excellent. Thank you, Heidi. Thank you, everyone, and we will see you next week.